please. Start with your timer and see if your question. Right, so if you have read and understood, considering its surgical anatomy station, kindly tell me in which region is this marked with these colorful triangles?
The region which is marked in the red triangle is the anatomical snuff box.
Good.
And
Can you
the
tell
region
me
which is marked in gray is
yes,
this
please.
one,
Yes,
is
please.
the lateral part of the dorsum of the hand, ma'am.
Okay, showing kind of a dermatome of the hand. Okay, can you please tell me the
Yes,
boundaries
the
of
dermatome of the
that particular first web space or dorsum of the. Okay, can you
radial number.
can you please tell me the boundaries of the anatomical snuff box?
The medial border is formed by the extensor pollicis longus, and the lateral border is formed by the extensor pollicis brevis and the adductor pollicis brevis. The distal border, the distal end is the apex of the anatomical snuff box, and the proximal end is the styloid process of the radius. The floor is formed by the scaphoid bone.
What are the contents of the anatomical snuff box?
The radial artery is a content, and the radial nerve of cephalic vein may pass over the snuff.
Can you please tell me how the insertion of extensor pollicis longus tendon is done? How does it take place?
Extensor pollicis longus is originated from the lateral epicondyle and is
just insertion.
Insert.
Yes.
Insertion is at the metacarpal pharyngeal joint.
Dorsum of the base of the terminal phalanx of the thumb. Proper answer. Okay. And what about the insertion of extensor pollicis brevis muscle, please?
I have no idea. Maybe the distal phalanx.
Yes, proximal. That one, extensor pollicis longus was terminal. This is proximal phalanx of the thumb. So that's why it's like important. It's
all right.
Yeah, that's the difference you have to remember. Okay, can you please tell me what are the movements which are possible at the thumb joint?
There is flexion, extension, abduction, adduction, and opposition of the thumb.
Okay, can you please tell me which nerve is responsible for the opposition movement of the thumb?
The median nerve is
very good.
As it
And which muscles
of the thenar eminence.
Which muscles? Median nerve through which muscles?
The muscles of the thenar eminence.
No. Opponens pollicis and flexor pollicis brevis.
So the muscles of the thenar eminence. Flexor pollicis brevis.
Okay. Can you please tell me in the hand, how would you test the first tell me where the flexor digitorum superficialis and flexor digitorum profundus insert in the finger.
The flexural decidorum superficialis has a split tendon which
Very
attaches to
good.
the sides of the medial phalanx,
Very good.
and the flexum decidorum profundus travels through the split tendon of the FDS and attaches to the distal phalanx.
Very good. How would you test both of these tendons?
Ma'am, for FDP, we have to hold the proximal interphalangeal joint in extension. And for testing the
by
FDS, we have to keep
by
the
fixing. Yes. And then the other one?
yes, ma'am. In the other one, we have to keep other fingers, the adjacent fingers in extension.
Okay. Can
Hello.
you please tell me how would you test for the ulnar artery?
We can perform the Allen's test. In the Allen test,
How
we
is it
can
done?
ask the patient to elevate his hand and make. We will ask the patient to elevate his hand and make a fist for 30 seconds, and then we will occlude his radial and ulnar artery. And after 30 seconds, we will ask him to open the fist, and we will remove the pressure from the ulnar artery. The hand which is blanched will return its color. Then within seconds, then the ulnar artery is perfusing the hand.
Okay, can you please tell me why the grip of the hand it's more powerful in extension as compared to flexion?
When the flexor muscles are more stronger than the extensor muscles.
Just close your eyes and imagine that what's happening, what is the mechanism behind it. Once you are extending the flexor muscles in extending position, then what's happening? Tension is being created where? Okay, you think and tell me afterwards.
Yes,
All right.
ma'am. Okay.
Can you please tell me what are the bones which form the, what are the carpal bones? How many carpal bones are there and how are they arranged?
The distally there is scaphoid, lunate, triquetrum, and
Wait,
pisiform, and
first
proximal.
Yes, arrange your answer in a better way, that these carpal bones, they are 18 number and they are arranged in 2 rows.
Okay.
Now then tell me,
Yes,
first row and the second row.
yeah, there are 8 carpal bones arranged in 2 rows. The first row is formed, which is the proximal, is formed by the scaphoid bone, lunate bone, triquetrum, and pisiform, and the
How are
second
you
line,
telling me from medial
which
to
is the
lateral or
distal
lateral?
line, start.
Yes. How are you telling me, from medial to lateral or lateral to medial?
Sorry, ma'am. From lateral to medial. Lateral
Yes.
to medial.
Okay. So what is special about the scaphoid bone?
And the second line is
Yes.
from the
Scaphoid is it
the
articulates
scaphoid
with,
bone,
yes,
ma'am.
how many other carpal bones? Scaphoid articulates with how many other?
Scaphoid articulates with lunate medially and trapezium and triquetrum superiorly, distally.
Okay, what might be the characteristic pain that the patient felt while skiing and getting injured? In the stem?
Characteristic of pain.
In the stem, yes.
Sorry, ma'am, couldn't hear you.
Yes, what was the, sorry, time went, we were asking very slow. This skier fell on outstretched hand and now was feeling pain between his
Yes,
thumb and index finger. What is your diagnosis? What is the characteristic pain?
Ma'am, the patient, considering the history of the fall, the patient could be suffering from a scaphoid fracture.
Okay. What are the measures or precautions that you should keep in your mind once you suspect fracture of scaphoid?
Ma'am, as scaphoid is very vulnerable to vascular necrosis
Very
due
good.
to its vulnerable blood supply to the proximal part. So, a chance of vascular necrosis should always be kept in mind. Also, the fractures of scaphoid are not readily diagnosed on primary radiographs. Therefore, follow-up is necessary.
Yes, and it's basically clinical diagnosis. Okay, can you
Yes, ma'am, sir.
please identify quickly the labeled structures in these diagrams? What kind of image are you looking at?
Ma'am, this is a radiograph of the right wrist joint.
Okay,
The first image is in that the bone which is labeled A is the scaphoid bone, and the bone which is labeled B is the radius, and the labeling C is for the first metacarpal bone, and the label D is for the lunate bone, and labeling E is for the ulnar bone. Ulnar.
okay. How the wrist joint is formed?
And the wrist joint is formed between because articulation between the distal end of the radius, the scaphoid, and the triquetrum, and the distal radioulnar joint.